Mr. Yip Hon Weng.
Mr. Deputy Speaker, sir, I support this bold initiative to promote preventive healthcare. This white paper has naturally gotten a lot of attention amongst my senior residents and the GPs in Yio Chu Kang, which is a mature estate. Having spoken with them, I would like to raise feedback on several areas. First, Mr. Deputy Speaker, sir, I will discuss Healthier SG from my residents' point of view. My residents are generally happy with the Healthier SG benefits. Notwithstanding, there are a few concerns. First, can a patient who has already enrolled with a family doctor consult other GPs and still enjoy Healthier SG benefits? I would like to highlight TCM treatments. Many patients also like to get a combination of Western and TCM treatments for their ailments. Some elderly patients prefer to get regular acupuncture treatments at registered TCM clinics for their aches and pains, rather than to rely on pain medication. Will the government take this opportunity to review how we involve TCM practitioners in community preventive healthcare, especially since acupuncture is also offered in our restructured hospitals? Second, how will compliance and success be measured? Measuring health is unlike exercise, where we can determine participation and progress through counting the number of steps taken, heart rate, and so on. How does the GP and the wider healthcare system assess adherence and compliance? How do we measure the impact on the individual at the personal level? For patients who refuse to follow the prescribed health plan, how can we then determine whether the overall program is effective or even whether the GP is proficient? Having a good number of sign-ups is a favorable start. However, this does not necessarily guarantee in-depth participation. What is more important would be compliance to a single GP or the primary care network or PCN. How do we discourage the practice of GP hopping? Will there be penalties for either the patient or the GPs? Is this a key performance indicator, and who is it directed to? Third, can we speed up the implementation of Healthier SG to residents under 60 years old? I believe we should be more ambitious, especially considering that chronic illnesses can start in the 40s. One way to do this is by allowing family members to enroll in the program together with the senior. For example, if an individual is 60 years old and his wife is younger by a few years, can they both enroll at the same time? This ensures better compliance. They can motivate and accompany each other for consultations and screening and adhere with health plans. Mr. Deputy Speaker, sir, I now move on to what Healthier SG means for GPs. Our GPs have been very helpful with our efforts to build a dementia-friendly community in Yio Chu Kang. They shared with me some useful insights on Healthier SG. First, how adequately are our GPs trained in managing chronic diseases? A GP who wants to manage more complex health problems must begin their training from medical school. In big countries like Australia, there may only be one doctor serving one or even a few towns. The GP there are trained through medical school and postgraduate courses with the expectation that they will function as the only doctor in the town and would therefore be equipped as such, with skills spanning from common ailments to more complex chronic conditions. In Singapore, because of how accessible our tertiary healthcare institutions are, many of our GPs focus on common ailments and functions as referrers for more complex and serious conditions. Second, how many GPs are enrolled in our PCNs? This may give some insight on GPs' willingness to participate in Healthier SG. Do we have the majority of GPs on board the PCN initiative? What more can we do to get their buy-ins to provide effective care in the neighborhood? Third, will the cost of ancillary services be subsidized by the government so that it is on par with those provided by tertiary healthcare institutions? The government has gone to great lengths to reassure us that the drug cost parity between prescriptions from GPs and polyclinics is reduced. Will this be done through restricting the brands of drugs brought in? What happens if a patient opts for branded medication, as drug sales constitute a large part of GPs' incomes? How will drug cost parity affect a GP's willingness to sell generic drugs? Does this also extend to the cost of auxiliary services, such as blood tests, X-rays, and other related services provided by GPs? The white paper also mentions a team-based care approach. Will this be similar to the PCN, where back-end support for care coordination and other ancillary services are provided to the GP? Would GPs have to hire additional manpower or to pay for these services? Fourth, how many more staff are required to deal with the additional administrative workload and to handle social prescription? Under Healthier SG, we expect GPs to provide advice on lifestyle and dietary habits. But such social prescription can involve a longer consultation session and probably over an extended duration of time. In the meantime, GPs still have other patients' ailments to tend to. Can a GP count on the care team to help out, or will they have to hire additional staff if they are unable to manage? This is more so in solo practices and goes back to my previous point on getting more GPs to join PCNs. In tertiary healthcare institutions, typically you will have a nutritionist speak to a patient on diet, and then there will be other healthcare professionals and programs to deal with smoking cessation, weight loss, and so on. With many GPs still practicing solo, would they have the time and resources to do so? In Australia, GP visits are by appointments. This gives them adequate time to holistically review a patient's clinical and lifestyle needs, including making adjustments. In Singapore, it is generally a numbers game. The more patients a GP sees, the more money a GP makes. It would only be natural that the GP would want to earn more by seeing more patients. Fifth, will the annual fee for providing care for enrolled patients be extended beyond CDMP conditions? This could include frailty and mobility issues, which are common with old age. Delaying the onset of such problems are critical in preventive care and will greatly help to improve the quality of life. Six, I hope that under Healthier SG, GPs can be incentivized to start end-of-life care planning with their patients. This includes encouraging them to do advanced care planning or LPAs at the opportune time. These conversations are best started by people like GPs who knows the patient best and ideally understand the patient's family and social context. It is these meaningful conversations that may need to take place. It is not so much to bend the cost curve, though it might, but it helps people prepare for the inevitable and for families to be at peace with their decisions. Lastly, Mr. Deputy Speaker, sir, I will now talk about the role of the community care providers in Healthier SG. Can the Ministry clarify whether screening under Healthier SG are primarily done by GPs or elder care centres or ECs? The white paper mentions leveraging on physical spaces in ECs to conduct activities like health screening, early detection of dementia risks, and other healthcare initiatives for seniors. Yet GPs are also expected to conduct screenings. What is the envisioned eventual end state? Regular opportunistic screening systems may make screening more widely accessible. However, they could be confusing and overlapping in intent, thus resulting in excess costs. In conclusion, Mr. Deputy Speaker, sir, Healthier SG is a paradigm shift. The government's Population in Brief report was released last week. It shows that Singapore continues to grapple with long-term issues such as low total fertility rate and the aging population. The responsibility of caregiving for older family members will rest on fewer shoulders. If all of us can take better care of ourselves and be more independent in our silver years, we can help reduce this caregiving responsibility for our loved ones. At the systems level, this means reduce fiscal funding on healthcare so that money can be better used in other areas. But what matters most is for the individual. I recently spoke with Madam C, a senior living alone in Yio Chu Kang. I often see her around in the neighborhood, Most of the time I see her at the weekly exercise class in the park or at the market after her exercise for breakfast with her exercise khakis. I asked her what she thinks is a good life. She told me that being in her 70s, she doesn't ask for much. She said as long as she can eat well, sleep early, exercise, and meet up with her neighbors and her friends, she will have lived a fulfilling life. And with the benefits of Healthier SG, such as having an assigned GP who knows her well and having a proper health plan to keep healthy, I'm certain she will be active and can enjoy her silver years for many more years to come. The focus should rightly be on health and not on healthcare, and to stay healthy in the community for as long as possible and not in the hospital. As such, I would like to take this opportunity to encourage all eligible residents listening in to sign up with Healthier SG as soon as the opportunity avails. Let's all do our part to take responsibility for our own health and build a healthier Singapore. I support the motion. Thank you.